I find like more than 6 to 7 questions asked about post-delivery. So I think post-delivery recovery, C-section delivery, weight loss, hair fall, how to boost immunity, especially how to take care of the bones and lactational issues. So I think each and every question is a topic by itself, but I will try to like probably sum it up or summarize for you the main points so that you can deal with it. Like I had couple of videos earlier. I had commented on the hormonal changes which a mother would go through post delivery. It's more unimaginable because there are plenty of hormones which play a role during pregnancy and more so post delivery, and it's physically, psychologically draining for the mother. Why? Because one, she has to keep up with the demands of the baby, and what I mean by the demands of the baby is there will be issues on sleep, there will be issues on food, there will be issues on physical appearance for the mother. We all think that's a very small issue, but each and every thing which I mentioned right now makes a lot of difference. Let's come to sleep. The tip which I want to give you, a practical tip which I want to give you as a mother myself, as a gynecologist and a fetal medicine consultant would be, I would just tell you, forget about the timing. Just forget about what the clock says. Sleep when your baby is sleeping. Don't keep the time when your baby is sleeping to do the household work or to do your kitchen work or anything. I would say rope and help. This is the most important phase of your life. Whether you're going to go through it once, twice, or even thrice, rope in all the help possible. The first 3 months post-delivery is extremely important, that you need adequate amount of rest for your body, for your mind, for your baby as well. Because the first 3 months is the most important phase where you get to bond with the baby exclusively with the baby, and you need help on all the other fronts. So the first thing what you need to do is ask for help. Please don't feel intimidated asking for someone for help. Go out, reach out, let it be your parents, your in-laws, your relatives, your friends, your cousins, let it be anyone. Ask for help. Sleep when your baby is sleeping. Let it be even if it's morning 10 o'clock, if your baby is sleeping for half an hour or 45 minutes, room, close all your curtains, make it a dark room, quiet place, and sleep, because you can sleep only when your baby is sleeping. That's really one important practical tip. By most of the mothers miss out on that, and they feel really tired because you cannot expect the babies to sleep like our human body would work, because their body clock or their body mechanism is completely different. They wake up every 2 hours, every 1 hour, or even every 3 hours once for feed. So sleep when the baby sleeps. 1. 2. Do not worry or do not be too critical on yourself immediately after delivery. Trust me, everything is going to change, because work on your body slowly. You need that time to recover yourself. The uterus should come back to its normal size, and it will take minimum 6 to 12 weeks for it to come back to its normal size. It's not only about the uterus, but let it be a cesarean section or a normal delivery, the uterus size will shrink only after 2 to 3 months of delivery. It doesn't really change between the mode of delivery. Also, you're feeding, and you also need to know the diet which you have is more important, as much as important like any other thing, because the diet which you have will influence the amount of breast milk which is produced. 1. 2. Hydrate yourself. The hydration is also very important, because most of the milk, when you feed your baby, you get dehydrated a lot. You lose calories. If you have not known, there's one of the, I think you'll be happy to hear that when you lactate, you are burning calories. So you don't have to exercise for the first 3 months, but you need to take additional 400 to 500 kilocalories because you are lactating mother. 400-500 kilocalories is more on a healthier way rather than junk eating. Try to avoid very spicy food and very bland food also. Keep it in the moderation. Probably for the initial few days, you can have a little bit of bland food. Veetlalan, they used to say pathya saapaadu solvanga. Yes, it all has a meaning, hidden meaning in it, because the mother who just delivered cannot tolerate spicy food. More so, a baby cannot tolerate spicy food all of a sudden. So you need to introduce all that in small quantities. The breast milk flavors changes as much as and it also depends on what food you take. So that's very important. Hydrate yourself, sleep well, have nutritious meal, and 4, you start exercises only after 3 months or 4 months post delivery. And you start with mild minimal exercises. There will be patients who have already been experts or who have already been doing like a lot of yoga or strength training or cardio before, when they were either pregnant or prior to pregnancy. For them, yes, it will be a little easier, but most of them whom I know or the patients whom I meet, they are not exposed to any kind of exercises before. So start with simple walking, probably 15 to 20 minutes in a day. I've already mentioned about that in my earlier videos. You can increase the number of minutes of walking every day. You can make it twice a day. Freshen up yourself, have bath twice a day. It's extremely important that you don't pass on any infection. And also, one more thing I would like to say, that one of the questions over here was, can we wear tummy belt? That's the belt around your tummy because it's sagging. Very common question. Do not expect anything to happen as magic to reduce your pregnancy tummy after delivery. It's not going to happen. The tummy belt, why it's given by, like, few of them prescribe, few obstetricians, few of them we do not even prescribe tummy belt. It's because it's only for stability, that you don't feel uncomfortable while walking or standing or sitting. That's the only reason why we prescribe tummy belt. Tummy belt does not reduce your tummy fat. It cannot bring your tummy back to normal. Only exercises can, only our abdominopelvic muscle exercises can bring it back to normal. So it is possible too. So start with mild walking. Use of tummy belt is just for support purposes and not for your tummy size to reduce. Okay, and kind of hair care, I think many of them have asked about hair care. Actually, I would say, see, you might experience a lot of hair fall soon after delivery. That's thanks to the hormones, because estrogen and progesterone play a main role in your hair follicle growth. During pregnancy, you'd be surprised if you have noticed that most of them will not have hair fall during pregnancy, but it happens post delivery, and more so within the first initial 1 or 2 months of delivery. That's when you have a lot of hair fall. That's because your immunity is less, the nutrition factor is very less, and your hydration is less. And most of the hair fall usually settles down by 3 to 4 months post delivery. So don't worry if you have raw hair fall. Concentrate on your nutrition, hydrate yourself, and have a balanced meal, and start your exercise or workouts after 3 completed months of your delivery. And yeah, especially for your bones, I think they've asked for how to take care of our immunity and bones. Yes, it's very important that you continue your iron and calcium tablet. That's your vitamin supplementation, which you have had during your 9 to 10 months of pregnancy. Kindly continue it post delivery too, minimum for 3 to 6 months. It's very important. Iron, as I already mentioned, because for your blood loss which you have had during pregnancy or post delivery also, and calcium is very important because you're feeding the baby, and even for your protection for your bones. I think I pretty much summed up postpartum. Every aspect of it, I'm going to have a detailed video on hair loss, breastfeeding, different topics on breastfeeding, and lactation, more so about breastfeeding. So I encourage you to ask a lot of questions, because only then I will know what are the common things that you want me to answer. Keep your questions coming. We will see on a detailed video on lactation, detailed video on postpartum depression, detailed video on postpartum hair fall.